Hello, my name is Dr. Singhi. I'm a thoracic medical oncologist at the University of Texas MD Anderson Cancer Center. Honored to be here in Barcelona for the World Conference on Lung Cancer. Really heard about some exciting data, got to see friends, colleagues, meet with patient advocates. The networking is just as important as the science, in my opinion. I was honored to be invited to participate in the patient advocacy track this year. I participated particularly in a session that's focused on how we can personalize cancer care for patients even from the time of diagnosis all the way through survivorship. And what I talked about here at the World Conference on Lung Cancer was how we can use digital platforms like social media to educate, engage, and empower patients. And so I gave very concrete examples with some key takeaways of how we as healthcare providers can contribute to meaningful information that's accessible, easily digestible for patients with lung cancer and their loved ones. So the first day of the World Conference on Lung Cancer, we had a very interactive workshop that was led by the IASLC Communications Committee. Excited to be a member of this committee moving forward. And what we talked about was a variety of different topics. One aspect of the workshop that I really appreciated was led by my colleague, Dr. Mara Antonov, and she debated Dr. Stephen Liu about, is social media still relevant to disseminate information, to disseminate the latest findings of lung cancer? And one of the things that was highlighted was how much misinformation and disinformation there is that's out there about lung cancer specifically. And so we talked about ways to be able to identify it, to help our patients identify and help community oncologists, even academic oncologists identify it, and ways to maybe help dilute it, right, with credible voices that can bring evidence-based medicine, evidence-based guidelines to our patients who are actively using social media. So we can find different ways to dilute, again, that disinformation and misinformation. In addition to my commitments for the patient advocacy track this year, I'm also really excited to be able to talk about some research that I participated in specifically for patients with EGFR-positive disease. The World Conference on Lung Cancer had an excellent presidential symposium on day 2 focused really on patients for EGFR-positive lung cancer, where we heard about updates regarding FLAURA2, we heard about the ACROSS-2 study, we heard about Harmony, all meaningful updates for patients with lung cancer, just to have that knowledge. And so the poster that I'm presenting is actually work that was done retrospectively. We looked at patients who had EGFR-positive lung cancer, and we stratified their outcomes based on age, based on the particular mutations that they have, and based on a co-mutation in TP53, this tumor suppressor gene. And we looked to see, based on those variables, what are the outcomes for patients, specifically who are on luspatercept, and then specifically just their overall survival in general. And what we saw is that for patients that had, who were young, first of all, which we defined as under the age of 50, if they had a classical EGFR mutation, they're really the cohort that lived the longest. We did see a particular impact with TP53 co-mutations for patients who were older. More to come about that, especially how to pack that up. We saw the data from ACROSS-2, I think, is very interesting. But overall, I think these are very meaningful studies to do, to look in the real world. What are the outcomes for patients with EGFR-positive disease? Can we better understand the prognosis of patients based on different variables like age, based on their co-mutation status, based on the particular EGFR mutation that they have? And so I'm really looking forward to being able to discuss that poster in just a little bit. Yeah, overall, really, really grateful to be here in Barcelona. Anytime you get to connect with colleagues that you work with, not only at your own center, but at other centers across the nation, across the globe, and not only your colleagues, but the patient advocates. That's really why we're here, right? Is to do things for our patients. And it's so inspirational to be able to see them here, to connect with them, and then to feel recharged and fueled to deliver even better care and hopefully better outcomes for our patients with lung cancer when I return home.